child between the ages of 0 and 6. And we asked them a number of different questions about which different early childhood services and programs they were aware of, which ones they felt were important, which ones they used, how often they used them, what kind of barriers they were experiencing and trying to use them, and then what other kind of informal supports they had. If like Heather was talking about, if you do have a medical emergency, who takes your second child for that afternoon? If you don't have milk and the baby's asleep, you have somebody that can run out and help you get that milk. Okay, so I am doing my slides in reverse, so we've covered this one. And go ahead. Thanks. And so then what we did with our answers is kind of, because I'm a statistician, I'm much more comfortable talking about how we process the data than actually the service delivery, the program delivery. That's sort of what my communications manager, that's what my community development people do. So, but I feel that it's very important what you do with your data, because what we did with our data really did influence what we found. Because instead of simply sort of counting up the number of parents that said different things, we were in a fortunate position that we could do some really deep statistical dives and look for the way that the parental characteristics were working together. So we were able to use the data in such a way that we could control for things like household income, gender, and marital status. We could hold all of those things steady so that we could really separate out how immigration and ethnicity were affecting the different outcomes, rather than having them all kind of stuck together. Next slide, please. And so what this showed us was that the most important parental characteristics in terms of which early childhood formal supports parents thought were important, were aware of, and used in Peel, this is a Peel-specific piece of research, are immigration status and ethnicity. And we found you need to know both of these things at the same time. And so in other words, if we looked at the trajectories of parents, there wasn't one sort of standard trajectory for the newcomer parent. This is what it looks like as you're entering Canada, been in Canada for 1 year, been in Canada for 2 years. But it actually, the trends were very different for parents depending on which country they had come from or which ethnic group they self-identified with. So there were certain groups of immigrants who came to Canada and almost immediately started to show trends that were very similar to parents born in Canada. And then there were other groups of parents from different countries who had a very specific trend unique to them that they maintained, whether they were here for 1 year, 2 years, 5 years, 10 years. Next slide, please. So that really helped us see that it's not enough to just think of a parent as a newcomer, or it's not enough to just think of a parent as of South Asian heritage. You really need to understand exactly where they've come from and exactly how many years they've been here. It really makes a big difference and is worth an investment of your time. Okay, and so when we looked at these trends, in general, there was one trait that held true across all the different countries of origin, and that was when newcomer parents arrived in Canada in Peel, again, this is Peel-specific research because the findings are a little bit different than what Heather's finding, but hers was a national piece of research. Our newcomers in Peel have some of the highest usage rates among any parents in Peel. They're using early childhood formal supports at a level that is much, much higher than any other group of parents. And that this usage level drops rapidly the more years a parent has been living in Canada. Next slide, please. So just to make this point a little bit clear, because initially some of the feedback was, well, that makes a lot of sense because their children are getting older. But I'm not talking about comparing a parent with a child that's getting older. I'm talking about holding a bunch of kinds of things steady at the same time. So if we have a family that moved to Canada from China last year and has a 6-month-old baby right now, and we compare that to a family that's moved to Canada from China 4 years ago, and they have a 6-month-old, the second family is likely to use much less of the programs and services that are offered to them than the family that's just moved here for 1 year. The first family that's only been here for a year is 71% likely to use a drop-in program that they're aware of. And the family that's been here for 4 years is only 63% likely to use that same program in the very same neighborhood. The numbers are similar in terms of prenatal classes. The brand new newcomer family is 46% likely to use a prenatal class, while the newcomer family that's been here a little bit longer with the same age of child is only 38% likely to use that same prenatal class. Next slide. It's actually, since I only have 15 minutes, we'll just skip that one. It says the same thing. So this really caught our attention, and it in many ways, it's a tremendous sign of success for the settlement sector in Peel. And Peel has an enormous rate of immigration. Brampton, there are some neighborhoods in Brampton that have the highest immigration rate in the world. And so we pay a lot of attention, and we really do work to try and get those families connected as quickly as possible. And this is a sign of tremendous success. We're very proud of the results. And it's really helped us see that that second to fifth year is where we need to put our focus now in the region of Peel. Why are parents of young children who have lived in Canada for 4 to 5 years less likely to use early childhood development services and supports than parents of young children who have lived in Canada for 1 year or less? So with this question, thanks, we decided to do a bunch of qualitative research. So we conducted about 20 focus groups in Peel in 5 different languages. Sorry. And we talked to parents, grandparents, service providers, and policymakers, just to get the widest kind of variety of input that we could into why this trend might be happening, so that we could figure out maybe how to support the next step. And we came out with 4 broad themes: the reality of life in Canada, access and availability of services, relevance and quality of services, and promotion and engagement. Thanks. So in terms of reality of life in Canada, we had a very consistent feedback on this point that there's almost a honeymoon period. I'm an immigrant to Canada, so I can talk about this in my own experience, that when you first arrive, it's almost like everything is new and everything is amazing, and you just want to be part of everything. And you're highly, highly motivated, and it's like a ticket to ride almost. And then after you've been here for a year, there's a certain amount of disillusionment that sets in when you find out that everything isn't different, some things are the same. And you're still faced with demands and stresses of life. You still have to make the breakfast, you still have to make the lunch, you still have to pay the bills. And so this has a measurable effect on the way that newcomers interact with the supports that are being offered to them and their family. Thanks. The access and availability of services was interesting. This part was also quite consistent. Travel in Peel, if you've ever been to Peel, getting around Peel is really different than trying to get around Toronto. We don't have the TTC, and most services have to be accessed by car or by fairly long, changing several times, bus rides. And when a newcomer family first comes to Canada, if they are lucky enough to have a car, they can travel as a family to the early childhood services. They can travel as a family to those toddler swimming lessons or to the story time at the library. But then what happens is, because of item number one, the parents get jobs, or at least one of the parents gets a job, and the car then is devoted to commuting, and there's no transportation left to get whoever is available to take the toddler or toddler swimming. So that's a really big difference between year one and say year three. We also in our communities found that there was an influence of certain cultural practices. In some families, the parents are expected to attend the programs together, and a woman attending by herself is not accepted at the same level of the same rate that the families attending together are. So that if the father has a job, that limits the mobility of the family as a whole to attend certain activities. And then the third thing is ineligibility. So in the settlement sector, which this room probably understands much better than I do, you're eligible at certain years for certain services. And so by the time a family has been here for 5 years, they're no longer eligible for the same access to everything or the same subsidies for everything. And so that is decreasing. And so that's something that maybe should be looked at. How long exactly does it take for a family? And then this has already been brought up by the other speakers, the relevance and quality of service. This was very surprising to us because we talked to a lot of parents who were not actively attending services, that were choosing not to participate. We got a lot of feedback that the number one reason they weren't was quality of services, concerns with the quality of services. Now, this is a big red flag for us, and we have spent a lot of time, and will spend a lot of time moving forward, trying to determine exactly what that means. Judith had some great ideas, which I took note of and will be following up on. But it came as a humbling experience to us and our partners that it is possible that people may not be attending because of cross-cultural concerns about quality, and we need to really figure out what specifically that means. Next line. And the fourth actually was covered really nicely by Heather in the promotion and engagement. There was a real lack of awareness, and we got really similar feedback. Please do not give us things in writing. I mean, we translate things into 14 languages similar to you, and that is not the desired way of communication, which is kind of old school. I mean, right, like how many of us are reading every pamphlet that we get? And that they felt that there was many missed opportunities to connect. One of the things we found was that there was 2 places in Peel that almost every parent both valued and used, regardless of age, regardless of gender, regardless of immigration, ethnicity, status. That was the libraries and the parks and recreation centers in Peel. And so we have really done a lot of work to connect the more sort of boutique services with the more sort of all-inclusive services and help them work together. Next slide. So in summary, in designing supports for parents, the combination of their immigration status and their ethnic heritage is crucial. Knowing one of those things is good and helpful, but if you can find out both of those things about a specific parent that you're trying to support or a group of parents that you're trying to design a service for. And then the second point is that newcomers are uniquely vulnerable after their first year in Canada. So those were the 2 main findings that we got from this study and that we're working on implementing in Peel. And again, I do want to emphasize that this is a Peel-specific study.